Thank you, Mr. Speaker, and my question is for the Minister of Health and Long-Term Care. The members of my riding in Davenport have been asking me about the new Mental Health and Addictions Leadership Advisory Council and its plan to provide better access, better quality, and better value. The Minister announced an important expansion of our mental health strategy that would help us improve access to services, reduce wait times, and close the gaps in our system. To help guide the implementation of this plan, our government announced a new Mental Health and Addictions Leadership Advisory Council. The Council will provide advice on the strategy's investments, promote collaboration across sectors, and report annually on the strategy's progress. The Council will be chaired by Susan Piggott, and the members of the Council include people who have experienced a mental health and addiction challenge, as well as leaders from across different sectors that serve people with mental health or addictions. Through you, Mr. Speaker, I ask, what are the priorities of this Council and what do they plan on achieving?
Thank you. Minister of Health, Long-Term Care.
Well, thank you, and thanks to the member from Davenport for this very important question. The council that she's referring to, the members will provide the government with important advice as we move forward with our mental health and addictions strategy phase 2's top 5 priorities. And these priorities include promoting resiliency and well-being for all Ontarians by expanding proven programs in schools and in the workplace, as well as drawing on public health expertise on mental health promotion and addiction prevention. Mr. Speaker, we're going to also, as a priority, ensure that early identification and intervention is available for those with mental illness and addictions. We're going to, as a third priority, expand housing, employment supports, and initiatives to reduce contact with the criminal justice system, providing the right care at the right time and in the right place through initiatives such as better service coordination, addressing gaps in the system, and improving transitions. We're also going to be establishing a new funding model linked to population equality improvement and service integration. Thank you, Mr. Speaker.
Thank you. Supplementary.
Thank you, Minister. We know that approximately 1 in 5 young people in Ontario, that's more than 2 million, are dealing with mental health issues like anxiety, depression, and eating disorders, and approximately 70% of mental health and addiction problems begin in childhood and adolescence. Nearly 30% of my constituents in Davenport are below the age of 25. The promotion of overall healthy well-being is absolutely crucial for these young people. Many community organizations help young people increase self-esteem, such as the Dovercourt Boys and Girls Club and others, which provide support through services such as counselling, like the Abrigo Centre and the Davenport Perth Neighbourhood and Community Health Centre. However, many are looking to our government to take an active leadership role in supporting these Ontarians struggling with mental illness.
Question.
The first phase of the mental health strategy was focused on children and youth. Minister, how will you continue your commitment to the segment of the population in the second phase?
Thank you. Minister.
To the Minister of Children and Youth Services.
Minister of Children and Youth Services.
Thank you, Speaker. And I too want to thank the member from Davenport for raising this very important question. As she said, the first 3 years of our mental health strategy has been focused on children and youth, and that's because it was the right and the smart thing to do, Speaker. Today, more than an additional 50,000 children and youth and their families are benefiting from these initiatives and programs. And while we are proud of our accomplishments, we know there's more to do. My ministry will continue to work with our partners and transform the child and youth mental health system through our Moving on Mental Health plan and promote community mobilization as we move into year 2 of our youth suicide prevention plan. Together, we will help young people with mental health illnesses enjoy the very bright future that I think we'll all agree they deserve. Thank you, Speaker.